Hi, my name is Brian Apavu. I am a neurologist and epileptologist with an interest in philosophy of the mind and living the examined life. Today, I want to dive into the topic of epilepsy, which has been and is becoming a large focus of my ongoing clinical work. Just for reference, I am a board certified epileptologist and clinical neurophysiologist with over 8 years of experience after fellowship training. So, why don't we start with the basics? What is epilepsy? Epilepsy represents a brain disorder that causes recurrent, unprovoked seizures. It's important to note that not all seizures are caused by epilepsy. Some seizures may relate to a recent brain injury, or in some children, it might relate to a time limited period in their lives where fevers can cause seizures with what we call febrile seizures. With epilepsy, however, we think that there is a reason for which seizures are unprovoked and likely to reoccur. It's important to know that receiving a diagnosis of epilepsy doesn't necessarily mean that the condition is severe or progressive. It also does not define the cause of why seizures are occurring or recurring. It simply means that it is a condition where unprovoked seizures are likely to occur and reoccur. Epilepsy is a spectrum disorder, and there can be different types of seizures, different types of epilepsies, different epilepsy syndromes, and different causes for the seizures that arise with the underlying condition. And in future videos, I hope to go into more details on that, but I want to keep this one fairly broad and basic on the idea of what epilepsy is. So, how is epilepsy diagnosed? Clinicians traditionally make the diagnosis of epilepsy when a patient meets a number of criteria that have been established by the International League Against Epilepsy with their classification system, the ILAE system. And this includes the following. Number one, at least two unprovoked seizures or reflex seizures that occur more than 24 hours apart. Number two, one unprovoked or reflex seizure, and the probability of further seizures similar to the generalized recurrence risk, which is at least 60% after two unprovoked seizures occurring over the next 10 years. Or number three, a diagnosis of an epilepsy syndrome. The rationale for these criteria were made to ensure that the diagnosis reflects an enduring predisposition to generate epileptic seizures rather than a single isolated event. And these were designed to guide the appropriate management and prognostication after seizures occur or reoccur in individuals. The diagnostic process of coming up with the diagnosis of epilepsy involves a thorough clinical history, eyewitness accounts, and video when available. Electroencephalography can be used to detect epileptiform activity. However, a normal EEG does not necessarily exclude epilepsy, as up to 50% of routine EEG studies might be normal in a patient who actually has epilepsy. Neuroimaging can be helpful, particularly brain MRI imaging, and it is recommended for most cases except for certain generalized epilepsy conditions with very classic clinical and EEG features. The International League Against Epilepsy classification system also emphasizes the importance of identifying the seizure type, the epilepsy type, and when possible, a specific epilepsy syndrome, as well as determining the underlying etiology, which could be structural, genetic, infectious, metabolic, or unknown. The rationale for the two unprovoked seizures criteria is based on longitudinal studies showing that the risk of a third seizure after two unprovoked seizures appears to be approximately 73% over a 4-year period, indicating a high likelihood of recurrence and justifying the diagnosis of epilepsy. The inclusion of one unprovoked seizure with equal or greater than 60% recurrence is grounded in clinical data and evidence that suggests that certain clinical features, such as an abnormal EEG, structural brain lesions, or significant neurologic deficits, these confer an increased risk or a risk of recurrence of seizures comparable to that after two seizures, thus warranting an early diagnosis and management. The third criteria, diagnosis of an epilepsy syndrome, is supported by the recognition that specific electroclinical syndromes have been well defined through with having a well-defined natural history and its own recurrence risks, justifying a diagnosis of epilepsy even after a single event. There are tables and models that exist to show the probability of recurrent seizures based on any number of findings, including the number of seizures an individual had, neurologic disorder or abnormal EEG, and so forth. So, what are seizures? Seizures are a complex phenomena. Within the realm of epilepsy, we think of seizures as a sudden surge of abnormal brain electrical activity that may affect how someone appears or acts. Every brain has the potential to have a seizure, but individuals with epilepsy have a lower threshold to have seizures as compared to the general population. As I mentioned above, the diagnosis of epilepsy does not define the cause of why seizures are recurring or the prognosis of the condition of epilepsy. Epilepsy is a spectrum disorder, and that can include many different types of seizures and epilepsy syndromes. The impact that epilepsy might have on an individual will depend on a variety of factors, including the type of seizure that they have and how frequent those seizures are occurring, what part of the brain is affected by the epilepsy, the underlying cause to the epilepsy, whether it be genetic, structural, or whatnot, as well as the underlying brain abnormalities that may be present. Understanding the type of seizures that an individual has, what part of the brain is affected, the underlying cause to their epilepsy, and any underlying brain abnormalities that are there will help understand what's the overall prognosis for the epilepsy condition that a patient has, and what's the best way to approach it and treat it in a way that lowers their risk for seizures as well as improves the patient's quality of life. I hope this video was helpful for you. If it was, please like this video or subscribe to my channel. I hope to make a variety of other videos that go into more detail and more questions regarding epilepsy, anti-seizure medications, and epilepsy treatments, and as well as talking about different epilepsy conditions. I hope you have a great day and hope to talk to you again soon.